Hello everyone, I am Dr. Asa, Specialist Medical Officer. Welcome to the Advancing Tertiary Care PMGH series. This series aims to raise awareness about the specialized healthcare services provided at Port Moresby General Hospital. Through this initiative, we will highlight the hospital's growing range of advanced medical services and educate the public on healthy living and preventive health practices. For more than 50 years, Port Moresby General Hospital has served the people of Papua New Guinea by providing both primary and secondary healthcare services while fulfilling its role as the country's leading national tertiary, referral, research and teaching hospital. In his address on health, the Prime Minister, Honorable James Marape, emphasized the government's unwavering commitment to improving the nation's healthcare system, stating, "The Prime Minister's vision aligns with the National Health Plan 2021 to 2030, under which PMGH has been designated as a Level 6 tertiary referral and teaching hospital. This mandate drives PMGH to expand and enhance its capacity to deliver specialized healthcare services both locally, reducing the need for Papua New Guineans to seek medical treatment overseas."
The policy statement by the Prime Minister is directed at Port Moresby General Hospital and to deliver a comprehensive cancer service, to deliver a comprehensive heart and heart service, and the kidney services, which are the three common causes of deaths and admissions in the lifestyle disease category in our country, which Port Moresby General Hospital has to provide. Currently, many of our Papua New Guineans are traveling overseas, seeking specialized healthcare in cancer, in heart disease, and in kidney disease. So Port Moresby General Hospital Board has taken the challenge by the Prime Minister on board and framed the implementation plan to deliver that statement through the Port Moresby General Hospital Corporate Plan 2022 to 2024.
In our first segment, we will talk about tackling cancer in Papua New Guinea. In the first episode of the PMGH series, we focused on cancer, a disease often perceived as a death sentence in Papua New Guinea. A cancer diagnosis is indeed life-changing, but understanding the journey from diagnosis to recovery can empower patients to take control of their health and make informed decisions. To meet the country's growing cancer burden, PMGH is developing the Modern Comprehensive Cancer Center, a groundbreaking facility currently under construction. This project, described as the most complex healthcare development ever undertaken in Papua New Guinea, will serve as a one-stop, world-class center for cancer treatment, research and education. Chief Executive Officer Dr. Paki Molumi has provided a detailed overview of the project, explaining that the project is estimated to cost between 200 to 300 million kina. Due to non-availability of bulk funding, the project is being delivered in 4 phases to suit annual government funding, each representing a significant step towards transforming cancer care in the country.
This is the Port Moresby General Hospital Modern Comprehensive Cancer Center under construction. This is the most complex project ever undertaken. When you're talking about cancer, building a cancer facility, it is the most complex facility built anywhere around the world. So we are so privileged for this country to undertake such a project to address the increasing cancer burden in the country. So the construction has actually been divided into phases. In fact, 4 phases now. So phase 1 was the construction of the cancer bunkers, 2 cancer bunkers, which we have completed. Phase 2 was the structural works. Kumul Petroleum funded that, and we completed phase 2. Phase 3 is almost 80 to 90% complete, which we are going to walk through and we will show you. We have a very good project team, trying to manage 2 builders together to get this project moving. So project management, quality control is provided by Flotint, Australia, who have more experience in building cancer centers and ensuring that what we deliver meets international standards and also International Atomic Agency standards.
Mr. Carl Adams is the Managing Director of Flotint. Mr. Adams has been engaged by PMGH to provide project management and quality control of the cancer center. He has been coordinating and directing the design, equipment, certification, and accreditation of the center to ensure we meet world-class standards and provide a service that will deliver service quality to their best available in the world.
And so you can see the visibility of the corridor gives you very good access to it. At the end of the corridor is our first bunker for radiation therapy. But if you're inpatient, you're coming through that set of doors, that reception area, and you're directed along that other corridor. So this is one of 3 bunkers that forms part of radiotherapy. This is what we call the true beam, which is fairly high dose, large organ radiation therapy treatment. So here you get a very good indication of the depth of the foundations. The machine, the true beam in weight is about 4.5 tons. To support a machine of that nature, you need very strong foundations. This is our second bunker, and this is the second control room for that bunker. And if you zoom into it, you will see typically what the equipment would be like in this room. Normally the therapist sits to the front of the bunker, which will actually monitor the patient, and behind the therapist is the physicist who's done the planning for the actual treatment.
This bunker, when we build, they have 3 segments. First is the foundation. The second one is all the shear. We call that the retaining wall. And the last one is the roof deck. So before all this completed, we monitoring this in the concrete temperature, because this is one of the important. We don't want this concrete that to have a crack because of the radiation. So everything is monitoring according to the concrete standard for the curing system.
So here we're now standing, going towards the third bunker, which, as we've explained, is a much smaller bunker, treating a lot smaller lesions, especially in prostate and in breast. We will be focusing much more on breast in this area. And so the machines is much more mobile, so it's not so much the strength of the floor, but more the exposure to radiation.
So this room will be the brachytherapy room. Now the difference between a brachytherapy and a radiotherapy is that the dose is delivered through a ray in the radiotherapy. Whereas for here, we are going to take the dose into the patient. That's why it's called a brachytherapy.
The CT, you may get a contrast injection line put in, so that it can highlight the organ when we take the image, or you may need a biopsy done for also radiotherapy in the breast side of it. So this is a full bunker, like you've seen on the other 2, just a bit smaller. Whereas the CT the exposure is not as large, and so the walls will still be lead lined, but we're not having to construct, those 1.5 meter size walls for it.
I'll just take you through the patient flow. so that you understand the importance of this room and how it correlates with the radiotherapy patient. So when a patient with cancer comes to the hospital, the doctor takes a biopsy and say, okay, this is, for example, from the breast tissue, say this is a breast cancer. Then they plan for surgery if it is resectable. And then after surgery will require chemotherapy, which we went through. And if it requires radiotherapy, we'll have to come to this department for radiotherapy.
So because we wanted the largest gantry for that, this is the only machine that provides an 85 centimeter bore, so that we can take larger patients as well as smaller patients from that. Otherwise, you're restricted by the size of that gantry when you insert the patient for that planning. So this provides us the best on the market from that perspective.
In Papua New Guinea, oral cancer remains the leading cause of cancer-related deaths, followed by cervical cancer and breast cancer. Recognizing the need to address these most common and deadly forms, the PMGH Cancer Committee has prioritized the targeted programs focusing on prevention, early detection, and treatment. According to Dr. Molumi, the breast cancer continues to claim the lives of 2 women each day in the country, often because it is detected too late.
If you feel alarmed, you come to the hospital. That lump may be already big, it's detected by themselves at an advanced stage. Of course, we can do that, but for most general hospitals, we want to go further than that. So we'll be establishing now, as part of our cancer program, the cancer lab, one of which will have the molecular lab. So in that, we will be screening all the women for 2 genes. I think it's BRA2, AC2, 1 and 2. Those are the genes that are specific for breast cancer. If you have those genes in your body, you will possibly develop breast cancer somewhere down your lifetime. When you reach 30, when you reach 35, or even earlier, or 40. So it indicates that you are at risk of developing breast cancer. So these are the women that we are going to pull them out and put them into the breast cancer mammogram screening program. We can advise those women that are at risk to come and put them into a screening program, and then we can detect the breast cancers early. The screening program at the earlier is the most important. So that's PMGH will provide that comprehensive breast cancer program.
Now we will go for a short break, and when we come back, we will talk about support services that helps in diagnosing cancer at PMGH. Mammogram is an X-ray of the breast used to screen for or diagnose breast cancer by finding lumps, microcalcification, or other changes that may be too small to be felt. Mammogram is installed at the Radiology Department of Port Moresby General Hospital. Radiology is the medical specialty that uses medical imaging to diagnose and provide guidelines for disease treatment. Dr. Monica Clement and Dr. Mary Mumba are the radiologists who manage the radiology services of the Port Moresby General Hospital.
I'm Dr. Clement. I am the coordinator, coordinating radiology clinical services in Port Moresby General Hospital. In radiology department, we have 2 consultant radiologists, myself and we have about 20 medical imaging technologists that we work with and 8 training radiologists who are doing their masters. They're doing part 1 and part 2 masters in medical imaging. So this is and then 2 nurses and about 3 clerks. We also have different imaging modalities that we use in our daily services that we provide. One of them is the CT scan machine, floor-mounted X-ray machine, ultrasound machines. We have a mammogram unit. We have a new fluoroscopy machine that's coming. We are renovating the room to install it now. We also have in the past an MRI, but it's being decommissioned. We don't have it now. We are in the process of purchasing.
I'm Dr. Mamba, and I'm a radiologist at PMGH. I work as a doctor by body. Mammogram is a form of X-ray. It is specifically of the breasts. So it's a study of the breast that we do to check the masses within the breast. So after the technicians do the mammograms, we the radiologists have to read it. So we read the images and we say whether there's a pathology or not. And we recommend for further investigations or biopsies. So that information is relayed through the reports back to the referring clinician. If mothers want to have a mammogram, they have to see a clinician. The clinician will assess them and refer them for a mammogram. And those women have to be aged over 40 years. Below 40 years, we will do ultrasound for them.
Okay, for CT scan, usually 2 weeks. The mammogram reports come out in about a week, 2 weeks. Ultrasound scan reports, they come out the same day or the next day. The radiology reports also come out the same day or the next day. And then we have the fluoroscopy studies, the special X-ray investigations. They usually come out a week or 2 later as well.
The clinician is to see the patient and then send it to us to do the imaging study. Then the main way we convey the results is through the reports. But sometimes there are urgent cases that need to be, reports need to be given urgently. So when we are contacted by the referring clinician, we give a verbal report straight enough. And we try and fast track the report within less than the turnaround time so that the patient is managed.
Dr. Gabriela Ark, Acting Pathology Coordinator at Port Moresby General Hospital, explains that pathology also plays a vital role in diagnosing diseases by providing clinical teams with evidence that are needed for treatment and patient management. Without pathology results, clinicians cannot accurately diagnose or plan appropriate care.
My name is Dr. Gabriela Ark. So at the moment I'm the Pathology Coordinator at Port Moresby General Hospital. I took this seat just recently, but otherwise I've been at PMGH for about 7 years now. Pathology services, we provide the evidence to the clinical doctors that are in the ward to actually make their diagnosis, so then they are able to treat their patient and stuff. So we are here providing evidence for disease processes and conditions that are happening. So the doctors can then use that evidence to be able to diagnose, treat and manage their patients. So cancer services, at the moment at PMGH, we do blood tests, urine tests and biopsies as well. So when I say blood tests, apart from other disease processes we're trying to diagnose, in regards to cancer, we actually do blood tests that help us to show or rather detect abnormal cells. Secondly, we actually test for substances that are known as tumor markers. So when cancer is in our body, they tend to give off certain substances called tumor markers. So for example, for prostate cancer, we detect what's called PSA, that's prostate antigen tumor markers. And so that just tells us that, look, especially in the male population, this particular male could actually be having cancer, prostate cancer. We also detect other tumor markers like CA125 for ovarian cancer. So those are just blood tests. So we collect blood, pass them through our machines, and then they're able to detect certain cancers in the blood. The gold standard that we do is biopsies. Usually the surgeons or our doctors in the ward, when there is a growth of abnormal cells, lumps and bumps in places that shouldn't be there, then what they do is a biopsy. They take a piece of the tissue and send to us. We process it, goes through a whole process, and then our doctors, we're pathologists, so we sit under the microscope and have a look at those cells to say, look, they have normal cells, or they are abnormal, or what type they are, and then we're able to then provide that information to our surgeons and our clinicians, and then using that, then they move forward with the diagnosis, treatment plan, and management. So yeah, we do those 3 tests in the lab.
Our final topic is about cancer services provided at PMGH. We encourage women and men to visit the cancer clinic. Dr. Aina Anota works within the internal medicine department at PMGH, serving in the cancer unit. She explains that the cancer clinic operates as a day clinic from 8 a.m. to 4 p.m. Monday to Friday. Doctor consultation days are Mondays, Wednesdays, and Thursdays, where physicians see new and returning cancer patients for diagnosis, treatment, and follow-up.
At the clinic, a bit about what we do at the clinic: we diagnose and we treat and manage cancer. So in our clinic, days to see the doctors or doctors consultation days are basically Mondays, Wednesdays, and Thursdays. So that's where myself and my other colleagues, we come and we see our cancer patients, whether it's new cases to diagnose or whether it's old patients that they have some issues, whether it's to do with the cancer or with the treatment. That's when we see our patients. On Tuesdays are our breast screening days, where our nurses provide the breast screening services here, where they see any ladies or any even men from the public that want to have their breast checked for any lumps or bumps. And Fridays we don't have any clinics, but the nurses, they give chemotherapy to our patients on Fridays, but they also, throughout the week, they also give chemotherapy as well to the patients. I've been doing awareness to the business houses for about 2 or 3 years now. It came about because we've seen that there is still a need in the community to get more women coming in to check themselves for breast cancer, because at our clinic, breast cancer is one of the two top cancers that we see in our clinic on a daily basis. If you come in for a screening, let's say on a Tuesday, and we find that you have a lump that we can feel, we usually write a form and then you do a booking to either have a mammogram or an ultrasound scan. That's the radiology diagnosis. And the turnaround for the report time is usually lately it's like within a week. So it's been very good with the radiology team. And based on that report, if it's suggestive of breast cancer, then we send you to our pathology team, where they do what we call a biopsy, where a needle is put into where the lump is, and then a bit of the lump is taken out to be seen under the microscope to confirm for cancer cells. Usually the report, the turnaround time is 2 weeks, about 2 weeks. My message to the mothers and ladies out there: please get yourself checked. if you're over the age of 40, get a mammogram done. We have a mammogram machine here at PMGH. The fee is 10 kuna. A lot of women don't come. If you're over the age of 40, please come and get a mammogram. Mammogram is very effective in that it can pick up breast cancer lesion about 1.5 to 2 years before you can actually feel a lump. So that in itself is the difference between a stage 1 and a stage 4 cancer, and it totally changes your management and your survival outcome.
The cancer center is a comprehensive cancer center. We will have 2 of state-of-the-art linear accelerators. One is called Halcyon machine. The other is called a true beam radiotherapy machine, produced or manufactured by Varian, which is a US company. And then we will also have the brachytherapy unit, which is also from Varian. And we will have the high-end nuclear medicine department, and also the Planning City chemotherapy unit as well on the bottom floor. So on the upper floors, we will have the facilities that cannot be treated by radiotherapy or chemotherapy on the bottom floor, which is the radioiodine treatment, immunotherapy for prostate, and a cancer molecular lab, tumor board, and a cancer registry for the country will be housed on the upper floors, and of course cancer clinics. So that forms a comprehensive cancer center. So moving into 2030 onwards, we will have this into a National Cancer Institute. Why National Cancer Institute? Is because under our institute you can do teaching, you can do research, and you can also treat patients as well. And teaching and training will support the proposed Medical and Health Science University so that the next workforce for cancer are trained in this institute. So that's really the way forward for cancer services in the country.
It is important to carry out monthly breast self-examinations. A lump does not need to be painful to be breast cancer. In fact, most breast cancer cases involve painless lumps, either in the breast or under the underarm. We encourage women and even men as well to seek medical evaluation immediately if they notice a lump, many breast changes, or bloody nipple discharge. Early detection greatly improves outcomes. We acknowledge PMGH board, CEO and his executive management, the staff, specialist doctors for providing information and update on cancer, the Cancer Project Steering Committee, team at PMGH, the government of Papua New Guinea, Kumul Petroleum Holdings, donors, and our other stakeholders. Thank you for watching. Stay in tune for our next series on heart disease.